We're now joined by Dr. Ashish Jha. He's the Dean of Brown University School of Public Health. Good to see you, Dr. Jha. You know, we just heard Ben Tracy say that the White House, people working at the White House are waiting to see who's next. It must be very unsettling to work under those conditions. Do you think because there have been so many outbreaks at the White House that maybe they became overconfident in their testing, or is there something wrong with the testing? They use that rapid testing there.
Yeah, good morning, Gail. Thank you so much for having me on. The bottom line is that I think they misunderstood the role of that test. The test is fine. There's nothing wrong with it, but it's not anywhere near perfect. And they decided that somehow that was enough. They didn't need to do masking. They didn't need to do social distancing, that if they tested negative, everybody could go about their business. We knew that wasn't true, and we've been warning that this was likely to happen, and sorry to see that it has.
You know, the president has compared COVID-19 to the flu, which all the experts say is just totally incorrect, so much so that Facebook took down a tweet where he was saying that. When you heard that, what did you think? And can you just give us, set the record straight on why there is such a difference between the two for people that may still be confused?
Yeah, so it was frustrating because we've been saying this and people have been saying this for so many months. The bottom line is that COVID is about 5 to 10 times more deadly than the flu for almost every age group. And we don't even know the long-term effects of COVID. It may end up being quite substantial. So at this moment, comparing the two, I think, is irresponsible. And everybody knows that COVID is much more deadly. And I was hoping that the president would have changed his tune after going through what he's gone through. But that tweet really was upsetting for a lot of us to see.
Yeah, the president's doctor just released a couple of words yesterday. He said that he reported no symptoms, that his vital signs remain stable, yet we're still being told he's not out of the woods yet. What do you need to see, or what do doctors need to see to say that he is out of the woods? What should we be looking for?
Well, you know, what we know about this disease is that some people will feel just fine for a while, and then day 7 to 10 will all of a sudden take a turn for the worse. So we're still in that time period for the president. Obviously, we hope that he's not one of those people. We hope he recovers easily. But we're going to have to watch through the end of this week and maybe even into the weekend before we're going to sigh, a sense of relief that the president is through this.
5 days out, Dr. Jha, we still don't know when he got his last negative test. I think that seems to be very important for people who might have come in contact with the president. What do you think would be the reasoning for not releasing that information?
You know, Gail, I am baffled by this. I don't understand why the White House is being evasive on this. He's the president. Lots of people have been around him. Right. He should and they should just release the information. It will make it much, much easier for people to know if they were potentially infected, when he turned positive. The fact that they're being evasive on this really is baffling to me.
All right, Dr. Ashish Jha, thank you so much for taking time for us this morning. We appreciate it.
Thank you.